In SANAC, it was meant that there should be government, civil society, and private sector. And as various speakers have indicated today, therefore, it's important in that we complete this tripartite alliance of all these three sectors. Government participates largely through the Interministerial Committee, which includes more than 22 departments. Civil Society Forum has been quite an anchor in this, constituted by 18 sectoral representatives. It is therefore the right time now that the private sector forum has come to the table. It is worth noting, however, that the private sector has always participated in SANAC, in the work of SANAC through the stewardship of SAPCOA. Stats SA indicates that there are currently just under 17 million people who are employed in both formal and informal sectors. A significant number of people represented therefore by the sectors which we are launching here today, the private sector forum, representing those people who participate in the workplace. The private sector is a critical role player in our national and global quest to end HIV and TB by 2030. Certain industries are more prone to some of the epidemics by nature of their work. For instance, TB remains a serious challenge in the mining sector, and therefore we need to have tailored interventions in working with this sector in dealing with tuberculosis. Through engagements with sex workers, we have also established that the truck drivers are some of their biggest clients. Again, therefore, in a targeted form, this calls for interventions that will include addressing specific issues relating to the road freight industry. South Africa will extend, as Steve Litsike mentioned earlier on, will extend the National Strategic Plan for HIV, TB, and STIs for the period of 2017-2022 to end instead, not in 2022, but in 2023. And we'll start consultations on the new National Strategic Plan in the year 2022. The next NSP is going to be most crucial. It will be falling under the last leg of both the National Development Plan, which also coincides with the target, also the end target of the Sustainable Development Goals of the United Nations. This extension has been necessitated, as it's been mentioned earlier on, by the advent of the pandemic, which we are still battling. It is therefore reassuring that the process to develop the new NSP will be driven by the fully constituted SANAC, which will include government, civil society, and also the private sector. These sectors, all of us will be working together in steering the development of the new NSP and making sure that through this NSP we can do everything possible to reach our targets, both national and also globally for 2030. The advent of this pandemic has placed our health system under immeasurable strain and compromised progress which he had made in the fight against HIV and TB. There is a glimmer of hope, however, as we forge ahead with the vaccine rollout. We encourage all South Africans to get vaccinated when your turn comes. Currently, as we know, it's the turn of the health workers and also the over 60s, but everybody's turn will come in due course. This will help us arrest the pandemic and bring back some normality in our lives, both socially and also in the workplace and in the economy overall. This can only be achieved if every one of us play our role in adhering not only to the call for registration and vaccination, but also to the overall preventative regulations. We call on the private sector to preach this message in the workplace and create safer working environment that guarantees the safety of the workforce against this pandemic. Let us make our actions count by the basics of non-pharmaceutical interventions, as we know, wearing our mask, washing our hands and sanitizing, and also practicing social distancing and making sure that we avoid crowded situations. Deputy President, this inaugural private sector forum we are launching today consists of 24 members representing 5 different business formations, as already mentioned, and many of those partners have come forward here to address us. That is Business Unity South Africa, Black Business Council, South African Informal Traders Alliance, South African Waste Pickers Association, and also our Council for Medical Schemes. It gives me a great pleasure at this point to announce in this meeting the leadership which has been elected to lead this forum in an election which was facilitated by SANAC. The leadership of this committee is constituted by Chairperson Menompumelelo Zikalala, Deputy Chair Dr. Itumeleng Funani, members of the Program Review Committee and Plenary, Dr. Tutula Balfo, Dr. Lesego Rametsi, Dr. Tsepo Sidibe, and members of the Resource Mobilization, Mr. Carl Mansa and Mr. Simpiwe Mabele. We welcome you all to this SANAC family and hope that this will be a very fruitful relationship indeed. As already mentioned, we're looking up on you and we expect a lot, and we're sure that you're not going to disappoint, as you have already played a role, but now this is just to consolidate that role. We're looking forward to this sector also getting bigger. Let me at this stage, again, in introducing our Deputy President. I'm sure all of us know him very well. He doesn't need a lot of introduction. He's been with us as a Deputy President since 2018, continuing again since the last elections in 2019. He's also the leader in the governing party, the African National Congress, where he also serves as the Deputy President. He's been involved in over many years, from the 80s, within the student formations, within the teacher organizations, trade union, within the African National Congress, in the fight against apartheid. And he was one of those who, on the advent of democracy, not only led the African National Congress, but also has been a leader in government at provincial level, as MEC, as Premier, and currently as a Deputy President. So it gives me a great pleasure, Excellency, Deputy President, to invite you to address this audience on the launch of the Private Sector Forum. Thank you, Excellency, Deputy President.
Thank you, Deputy Minister Pahla. Let me also thank the Program Director, Kes, all Deputy Ministers that are present, MEC for Health in Gauteng, Dr. Nomathemba, CEOs of all members of the SANAC Private Sector Forums, Chairperson of the SANAC Civil Society Forum, Ms. Steve, labor representatives, happy to recognize the presence of the President of COSATU, Comrade Zingiswa, our development partners, the UN family, Dr. Mugabe and Dr. Kalua. Ladies and gentlemen, this is a very significant day in the history of the South African National AIDS Council, as we are gathered together to launch the Private Sector Forum of SANAC. It is nearly 2 decades since the establishment of the SANAC by Cabinet in 2002 as a multi-sectoral council consisting of government, civil society, labor, and the private sector, with the mandate of advising government on matters relating to HIV, TB, and STIs. While the South African Business Coalition on Health and AIDS has been playing an active role within SANAC, it is not representative of the broader private sector in the country. The establishment of the Private Sector Forum today, therefore, creates an opportunity for the private sector to be fully represented on all SANAC structures, thus ensuring the full constitution of SANAC as envisaged when it was established 19 years ago. This will further invigorate and enhance coordination of the private sector response to HIV, TB, and STIs. With the private sector constituting about 70% of the South African economy, it is a very key stakeholder in the socio-economic life of our communities. The private sector, together with government, civil society, and labor, plays a very important role in the developmental agenda of our country, including structures such as NEDLEC. The role of the private sector is also evident in addressing broader social challenges. As government, we recognize the inequalities that still hinder us from achieving our goals and believe that the private sector is better placed to contribute with resources at its disposal in our forward march in the struggle to end HIV and AIDS. For instance, the sector supports various initiatives and communities through corporate social investments, such in education and in strengthening our health system. Recently, with the COVID-19 outbreak, we acknowledge the prominent role that the sector is playing in responding to the very unprecedented challenge through the Solidarity Fund and other initiatives. We do acknowledge that even as the private sector was not fully represented in SANAC structures, but the sector has been actively implementing various programs which forms part of the country's response to HIV, TB, and STIs epidemic, though the response and the contribution was not coordinated. Previously, the sector responded by addressing the impact of the epidemic in the world of work. Over time, HIV and AIDS programs have been mainstreamed and integrated into ongoing corporate health and wellness programs. We are encouraged by the fact that many companies are implementing programs that are aimed at providing health services, not only to their employees, but also to community members within the areas of their operations. Therefore, the establishment of the Private Sector Forum enhances the role of the private sector in broader work on population health. It further creates an enabling environment for the private sector to make up comprehensive contributions towards our goal of ending AIDS. We also welcome the partnership between business and government to improve access to health services through digital platform that focuses on young people aged 10 to 24. As part of this ongoing partnership, the TB Health Check mobile application, which is used for TB self-screening, was launched in February this year. This is based on the success of the COVID-19 health check, which is currently used by almost 2 million South Africans to self-assess their COVID-19 risk. The Masoise Health Program, which was implemented since 2015 by the Minerals Council of South Africa, in collaboration with other stakeholders, including government, labor, and development partners, is one case in point. Its goal of reducing the impact of TB, HIV, occupational lung diseases, and non-communicable diseases as occupational health threats in the mining sector advances the National Strategic Plan on HIV, TB, and STIs, as well as sustainable goals, among others. Another example is the Anglo-American initiative, which leverages partnership to support and strengthen community health system towards advancing Goal 3 of our Sustainable Development Goals, which focuses on health. We know that there are many more initiatives that are undertaken by the private sector, and we encourage the sector to carry on implementing these and continue to find more innovative ways of responding to the health challenges that is facing our communities. Therefore, as SANAC, we recognize the valuable contribution that the private sector forum can play and has played in transcending inequalities in our healthcare system and in access to treatment. Program Director, we know that gender-based violence is one of the contributory factors to the spread of HIV. In the recent years, we have witnessed an increase in incidents of violence perpetrated against women and children and the LGBTQI community. There can be no doubt that gender-based violence also impacts negatively on the workplace, resulting in high rates of absenteeism and low productivity. The psychosocial effects of gender-based violence on the victims may sometimes result in the loss of economic opportunities and job losses. This is in addition to the challenge of gender dimensions of HIV, which also should be recognized in the workplace. It has been established that women are more likely to become infected and more often adversely affected by HIV than men, for biological, social, cultural, and economic reasons. Therefore, our HIV program must respond to the circumstances and needs of men and women in a manner that is appropriate to each group. We commend those companies that have heeded to the call by government to collaborate in addressing this scourge, including through the establishment of the Private Sector Gender-Based Violence and Femicide Response Fund. This fund is essential in the implementation of the National Strategic Plan on Gender-Based Violence and Femicide, as well as the broader country's response to this challenge. Ladies and gentlemen, although we have made significant progress as a country in the fight against HIV, TB, and STIs, we know that a great deal of effort is still required towards ending this epidemic. For example, we've surpassed the UNAIDS 90-90-90 targets in terms of percentage of people who know their HIV status. However, we still need to ensure that more people are enrolled on treatment and are retained in care so that they become virally suppressed. In that way, we will significantly reduce the chances of the virus being passed on to the next person. This makes treatment an important prevention method at our disposal. In addition to treatment, we need to work together as SANAC sectors to ramp up our prevention efforts so that we can reduce the rate of new HIV infections. According to the midterm review of our current national strategic plan, infection rates in our country remains high, and this is a cause for concern. We know that young people are more at risk of contracting HIV, and the private sector faces a threat in terms of new recruits in the work environment. Therefore, we call upon the private sector to intervene in addressing infections among this age group, more especially as they are at the start of their careers. If implemented strategically, workplace prevention programs can be very useful and cost-effective strategy to address HIV among employees. Prevention programs require strong leadership, support, and participation from all levels of the organization, from senior management to workers on the shop floor. In addition to HIV, we also encourage companies to pay particular focus on TB and non-communicable diseases that are silently impacting on the economically active population. As a country, we're also facing a challenge of people who are sick with TB but have not been diagnosed and are therefore not on treatment. These are the missing TB patients that all sectors need to put extra effort to find in order to prevent the further spread of this curable disease. Let us remember that in all our efforts of addressing challenges of HIV and TB, we must uphold the human rights of people infected and affected by this epidemic and never stigmatize and discriminate against them. It is also very important to remember that people with HIV are often healthy and are able to work productively for many years. While South Africa and the global community were already lagging behind in terms of achieving the 2020 targets for HIV and TB, this situation has been further exacerbated by COVID-19 pandemic, which has disrupted health service provision. In an effort to get us back on track towards attaining both our national and global targets, we have resolved as a country to extend the term of the current national strategic plan for HIV, TB, and STI, and fast-track the implementation of catch-up plans. We are pleased that the private sector will be part of this important process, and together as SANAC sectors will find solutions that will take us forward as a country. We commend the private sector for embarking on this journey of organizing themselves into a formal structure that will coordinate their participation within the SANAC family. We call upon the Private Sector Forum to rally all members of the private sector to be more coordinated in their response to HIV and TB and non-communicable diseases. We further call on the forum to facilitate financial contribution by various companies so that we support the country's response to these epidemics. As we close, we congratulate and welcome all members of the SANAC Private Sector Forum to the SANAC family. I can safely say now that sesiphelele sonke. I thank you very much.
Thank you very much, Honorable Deputy President, for your words and for encouraging us to actually collaborate in this very, very important initiative. We now come to the handover of a pledge from the private sector, preceded by a message of commitment from Ms. Nompu Melelo Dikalala, Chair of the SANAC Private Sector Forum, who I'm going to call up now. And she will also, after saying a few words, present a pledge to the Deputy Minister, who is Honorable Deputy President, representing you here today in accepting that pledge. Thank you.
Thank you, Kaz. Honorable Deputy President of the Republic of South Africa, and also the Chairperson of SANAC, Mr. David Mabuza, Deputy Minister of Health, Mr. Joe Patla, the interministerial committee members that are here with us today, thank you for joining us. The MEC of Health in Gauteng, Dr. Nomathemba Mokgethi, the CEO of SANAC, Dr. Tembisile Xulu, the CEO of SAPCOA, Mr. Siyabonga Chikwana, the President of COSATU, Mama Zingiswa Losi, the leaders of civil society, the co-chairperson of SANAC, Ms. Steve Letsike, the deputy chairperson of the Public Sector Forum, I'm not sure if it's right or left, Funani, but Dr. Itumeleng Funani, colleagues from the Private Sector Forum, and distinguished ladies and gentlemen, good afternoon. I'd like to start by thanking you on behalf of the Private Sector Forum, Deputy President, and everyone who's here present today for all your messages of support and encouragement. And note before I say anything that we have had the call for action. There were a couple of things that were said over and over when we were listening to all the various speakers. I am truly humbled to be here today as the newly appointed chair of the Private Sector Forum at this very defining moment in our collective efforts to achieve an HIV-free generation. The fight against HIV and TB started and continues to be a fight in support of human rights. As an advocate for an inclusive society, I believe that wherever we live, whatever our circumstances, in whichever place we have in the general society, whatever our gender or sexual orientation, our race, our religions, our beliefs, we are all equal insofar as human rights are concerned, and we are all deserving of dignity. Almost 40 years into ending the HIV pandemic, the work is still not done, as we all know, as there is still so much more that we can collectively do in our efforts and investments to advance the human rights of the people living with HIV. I am certain that many of us still remember the momentous AIDS Summit that was held in Devon in the year 2000, where over 5,000 activists protested outside the main event, calling for a more concerted response to the prevention, treatment, and care for HIV and AIDS and TB. Those early years of the millennium were arguably the most challenging. The scourge of HIV and AIDS and TB had reared its head globally, placing enormous challenges on the global health system and challenging big business to shape a rapid and a more sustainable response. At the very same AIDS summit, the late former President Nelson Mandela Madiba made this powerful call, and I'd like to quote: "In the face of the grave threat posed by HIV and AIDS, we have to rise above our differences and combine our efforts to save people. History will judge us harshly if we fail to do so. And if we fail to do so right now, and that was back in 2000. The fight against HIV and AIDS and TB has come a long way since then, with significant progress in the number of infection rates and access to medication, as well as care and prevention programs. However, the impact of the HIV pandemic has been felt across all sectors of our society, including the private sector. And we continue to see the devastating impact on lives and on livelihoods. We have lost many lives to despair, to the stigma, and to the exclusion, as has been mentioned by various speakers. The argument for great private sector involvement in the fight against HIV and TB is by no means an exclusion of government and civil society. It is a partnership, and I'm glad that there was the message that was echoed today. So we are here today to show a united front and to say we are here together, and we will do this together. And Deputy President, I agree with you. You said, "Sesiphelele sonke manje." I fully agree, sesiphelele, and we can achieve significantly more through all of us pulling together. As leaders in various industries across the economy, we are digging even deeper to sharpen our collaborative efforts to the fight against HIV and TB. And this is also very important when we look at the context of the COVID-19 pandemic, and also the fight against gender-based violence and femicide. We bring along with us, as the Private Sector Forum, a wealth of experience in our efforts to respond to HIV, TB, and STIs as part of our safety, health, and well-being workplace and community programs. And I think a lot has been said this afternoon around some of the programs that are already in existence. We will be building on what has been done up to today. We believe in the power of partnerships, and we continue to work closely with Mabuza, BBC, the South African Waste Pickers Association, the South African Informal Traders Association, SAPCOHA, which has played a massive role up to now, and we will certainly be building on top of that. And this is in implementing the United Nations SDGs of good health and well-being. Some of the key milestones include providing access to ARVs and other care and prevention programs to our employees and our communities, which are very dear to us, as well as preventing mother-to-child transmissions. All of these were reached in collaboration from all the different sectors. So we understand that some work has been done, but there's more that still needs to be done. Together, we have built healthcare facilities, invested in health research, and provided health screening to thousands of South Africans across the country. This is now our opportunity to invigorate this spirit once again as we work towards ending the fight against HIV and AIDS and TB. We therefore commit to continue working in partnership with government, civil society, labor, developmental partners, and various other stakeholders in implementing the NSP on HIV and TB. So as the SANAC Private Sector Forum, we pledge to do the following, and this is the pledge that we will be handing over shortly. Firstly, we pledge to ensure that the private sector participates fully in all SANAC structures at a sub-district, district, provincial, and national level. This entails launching provincial private sector forums across all our provinces. Secondly, we pledge to contribute to the achievement of the goals of the NSP on HIV and TB. Thirdly, we pledge to strengthen and accelerate workplace screening programs for HIV, TB, STIs, COVID-19, and non-communicable diseases. Number 4, we pledge to intensify the role of the private sector in the Check Impilo National Awareness Campaign, as well as many future campaigns that we will work on. And we will do this by fast-tracking our community screening for HIV, TB, STIs, COVID-19, and non-communicable diseases, supporting efforts of finding the missing TB patients, which is still critical, and also reporting private sector data on HIV, TB, and STIs to SANAC. Number 5, we pledge to participate and support HIV, TB, and STI-related activities at a national, provincial, district, and sub-district level. And this includes World AIDS Day, World TB Day, TB and AIDS conferences that will take place, and sexual and reproductive health campaigns. Number 6, we pledge to promote human rights by addressing the stigma, discrimination, and lack of confidentiality in the workplace as they relate to HIV and TB. Number 7, we pledge to address gender-based violence and femicide, and to promote gender equality and the empowerment of women in the workplace. We also pledge to reduce the vulnerabilities faced by women and girls insofar as HIV is concerned. Number 8, and finally, we also pledge to mobilize our resources to support the programs of SANAC. This is something that was said over and over again by the various speakers today. So we fully appreciate the role of the private sector, or the role that the private sector plays in our society, and the responsibility we have towards shaping a better South Africa for all that live in our country. We also acknowledge that we do not have all the answers. However, as President Mandela said, history will certainly judge us harshly if we fail to act, and if we fail to act right now. What the COVID pandemic has certainly taught all of us is that we can achieve amazing things if we pull in one direction with compassion and humility. So on behalf of the Private Sector Forum, we also say that the SANAC tripod, made up of government, civil society, and the private sector, is now complete, and we are standing firm within the tripod. Deputy President says Peled. So from now henceforth, we look forward to walking this journey with you towards an HIV-free generation. I thank you. Deputy Minister, would like to hand over the pledge to you, to hand over to the Deputy President.
Thank you very much, and thanks for the presentation of the pledge. We now come to our vote of thanks, and I'm going to call on Dr. Nomathemba Mokheti, member of the EXCO for Health in Gauteng. Thank you.